I know so many people who used to check it, and if they don't have it, they would take another vaccine. If they don't have it, they would take another vaccine somehow, some way. But that is not proven by any scientific literature that is the thing that you should be doing on a routine basis. This should be done as a research study. Okay. So I personally have not checked my COVID antibodies to date, and I have not checked it for any of my family members, my wife, my kids, my parents, and I have not personally recommended for any of my patients. Have people done that? Of course, they have done that. But is there an evidence that doing that is a good practice? I don't think so, because there is no clinical data which suggests doing that changes outcomes. By doing that, we should give more vaccines. There is no data based on that, because what you are actually measuring is one antibody level. But there may be different types of antibodies, and actually immunity is a two-phased immunity, two types of immunity. One is an antibody immunity, which is we call as a B cell immunity. There's a different type of antibody, different type of immunity, which is called as a T cell immunity, which are different type of cells, which are more stored cells in different cells, in different organs of the body, like the liver or the spleen or the lymph node or bone marrow, which there is no way on a routine basis we can check that levels, or we can just do a liver biopsy and we can see some T cells and we can say, yes, there is a T cell, now you have immunity. There is no consensus among scientists right now in terms of which test to do, how do you measure it, and is there an adequate level? There is absolutely no consensus, and that is not how we practice for any infection actually. We don't keep checking, your antibody levels or T cell and immunity levels for, let's say, measles or rabies or any other things. We don't do that. There is only a few situations it has to be done. And I don't think there is any convincing evidence that we should be checking it on a routine basis. If done, it should be done as a research protocol to further science. We should not be doing it on a routine basis. Does it fall? Of course it falls. But what we are measuring is the B cell immunity, which is the antibody. That will, of course, fall. Immunity first goes up. The curve is like this. So it goes up, it stays high for some time, and then slowly over time, it will go down. It takes 3 months, 6 months, or 1 year. Slowly, it will go down. After that point, you may not necessarily find adequate antibodies in your blood, but that does not mean you don't have immunity. You have the T cells, which are the memory cells. So the body remembers that there is something. If I was exposed to something, it is in a way like if you had a bad experience, let's say with some person that you don't like that person, you remember that feeling, right? And that feeling doesn't go away. You may have Dr. Srinidhi, or I'm sure I have those people in my life where even in my college days, I had a bad something with somebody and we don't really talk, we don't meet. And I don't keep thinking about it every single day. Oh, that person did that to me. I don't think like that. But even 20 years later, I might run into them, I meet them. I'm like, why did I meet this person?
Yeah.
Those feelings just immediately come. This guy did that to me 20 years ago. So you remember that feeling because it's somewhere deep hidden there.
Yes.
In a similar way, T cells are like that. They just let your body be sensitive to this virus and it will remain. And if you are exposed again to this virus, it will start reacting very fast and it will start fighting against that virus. And that immunity stays. However, if there is a completely new strain of virus, we will not get it. So let's say, like I gave you the example of a person, you might have some negative feelings or negative experience in the past. But let's say they change their appearance completely.
Yeah.
How will you recognize them? I look very differently with the way that I looked 20 years ago. People gain weight, they lose weight, they get gray hair, they lose hair. You might not even recognize them anymore. So you won't even have a response to them. They're like, unless they come and they start talking and they're reminding you of the same things again.
Yeah.
Oh, we went to college together, we did that together, and then that response might be triggered. So in the similar way, once a completely new strain of virus comes, we still will probably recognize, even if it's a completely brand new, we still will have some immunity to it. Maybe not as strong, but at least partial immunity.